I chose PTSD, or post-traumatic stress disorder. The reason I chose it was because I wanted to learn a little bit more about it. So let's get started. PTSD was first discovered in 1887 by Paris physician named Jean Clark. They noticed that hysterical attacks would occur following traumatic events. These events would follow months to years after the event. Jean Clark noted symptoms of the events occurred all throughout history. For instance, the earliest notated symptoms dated back to 4607 to 377 BC with Hippocrates as flashback-like dreams. Lucretius also wrote a poem titled De Rudum Natura in 50 BC that notated symptoms of PTSD. From 1337 to 1453, during the 100-Year War between France and England, they had documented many symptoms of PTSD that occurred through war. Shakespeare even wrote plays with symptoms embedded in it, like Romeo and Juliet, for instance. In the 1800s, PTSD was known as battle exhaustion or soldier fatigue. In 1915, during World War I, PTSD began recognition as being shell shock, and it was brought into medical literature at that time. They called it shell shock because people would go to war and bombs would go off and they would come back traumatized with all these symptoms. So that's where that came from. Experimental but not proven methods of electrical shock therapy began in 1950. That was the later treatment of it. In the 1950s, more humane methods of PTSD surfaced, but many people wouldn't speak up due to the stigma surrounding mental illness issues. These treatments included psychotropic medications and therapy. In the 1970s, studies began on survivors of the Holocaust. In 1974, Anne Wilbert Burgess and Linda Lytle Holstorm used the term rape trauma syndrome to describe symptoms of PTSD that occurred due to effects of rape. In 1980, the diagnosis of PTSD was finally put into the DSM. In the 1990s, new treatments surfaced included EMDR, which is eye movement desensitization and reprocessing, along with newer medications. What is PTSD? So it is a disorder that is triggered due to traumatic events. This could be natural disasters like hurricanes and things like that. Could be abuse in the home by a spouse, child, or a family member. It could be seeing or being the actual person involved, sexual assault, harassment. Fires could be one, can also include traumatic events happening to pets that reside within the home. And of course by war, because that's where everything first surfaced. Symptoms include involuntary distressing memories, dreams of the events, disassociated reactions, feeling as if you are living in the event again, psychological distress, physical reactions, avoidance, detachment issues, and there is a lot more. Treatments include prolonged exposure, cognitive processing therapy, EMDR, brief electric psychotherapy, narrative exposure therapy, written narrative exposure therapy, and cognitive behavior therapy. Medications that they may have you take is antidepressant medications like Zoloft, Paxil, Prozac, etc. Animal assistant therapy is also something that has recently surfaced not long ago. So the difference between PTSD and other disorders is that other disorders may have some of the same symptoms, but they're not triggered by a traumatic event. That's the main thing, is that they have to be triggered following a traumatic event in order to be classified as PTSD. In the DSM, you'll find PTSD under traumatic and stressor related disorders, beginning on page 271, spanning to page 280. So it states in that area that you have to have exposure to threatened death, serious injury, or sexual violence in one of the following ways: experiencing traumatic events firsthand, witnessing the events, hearing of the traumatic events happening to someone close, exposure to repeated asking about the events, so like a police officer or something that comes in and asks you over and over and over again what happened. According to the DSM, these are the symptoms: involuntary distressing memories, dreams of the events, disassociated reactions, psychological distress, physical reactions, avoidance of stimuli that include efforts to avoid distressing memories, including, so for instance, avoiding a home after there's a domestic dispute, avoiding people, places, conversations, and events. Negative alterations include inability to remember important aspects about the event, exaggerated beliefs about yourself or others, distorted memories, believing it was your fault, negative emotional state, lack of interest in activities, detachment from others, inability to experience positive emotions. Arousal and reactivity include inability to irritability and outburst, self-destructive or reckless behavior, hypervigilance, exaggerated startle response, issues concentrating, sleep disturbance. Other factors are depersonalization, or feeling detached as if you were on the outside looking in, derealization, feeling as if the event was unreal, and then delayed expression just means that symptoms didn't occur until 6 months post the event. These are diagnostic features. It explains what criterion there is in what section and what they mean. Same here. And then associated features: developmental regression, loss of language in a young child, pseudo hallucinations, difficulty regulating emotions, inability to maintain stable interpersonal relationships, dissociative symptoms. When the event ends in death, it can be problematic and most likely cause PTSD. Risk and prognostic features include 3 individual groups. I'm not sure why it says peritraumatic twice, but it's supposed to be pre-traumatic, peritraumatic, and post-traumatic factors. So pre-traumatic would be temporal, childhood emotional problems, 6 years old, mental disorders like panic disorders, depressive disorders, obsessive compulsive disorder, environmentally, lower social economical status, genetic and psychological, female gender, needs to be younger at the time of exposure. For adults, contains genotypes that may increase the risk of PTSD. Other genotypes may be protective. And then paratraumatic factors are just environmental, and that debates on the severity of the trauma as to if you'll get post-traumatic stress disorder or not. Then post-traumatic stress. Temporal would be negative appraisals, inappropriate coping strategies, and developmental of acute stress disorder. Environmental, subsequent exposure, repeated upsetting reminders, subsequent adverse life events, and financial or other trauma-related losses. Differential diagnoses would be adjustment disorders, acute stress disorders, anxiety disorders, obsessive compulsive disorder, major depressive disorder, personality disorders, dissociative disorders, conversion disorder, psychiatric disorders like schizophrenia, traumatic brain injury, service animals as treatment. They actually help. It's been proven that animals do help. They can be pigs, birds, cats, dogs, monkeys, service animals that are service animals, but not actually. Service animals can be chaotic in the public. They're trained to an actual service animal is trained to assist one specific person. They live with their handler no matter where they're residing. They can fly with their handler. They provide people with assistance in a number of environments for therapy animals. Therapy animals are not considered service animals. Emotional support animals. Support is through companionship. They also live with the handler regardless of policy. They may fly in the cabinet with the handler as well. Is not considered a service animal, but they are emotional support animal. Research has shown that the simplest things, such as touching the fur of an animal, can release endorphins and better a person's mood. Companionship through animals has also been shown to dramatically decrease anxious symptoms in individuals. These are reasons why animals have been proven helpful for PTSD as well as other mental disorders. Thank you for listening.